Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Misoprostol tablets, exploring the various aspects of misoprostol, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of misoprostol tablets. Misoprostol is a synthetic prostaglandin E1 analog used for various medical purposes. It is used primarily in patients taking nonsteroidal anti-inflammatory drugs who are at risk for developing ulcers. It is also used in combination with mifepristone or methotrexate to induce abortion during the first trimester. It is used to ripen the cervix and induce labor in pregnant women. For management of postpartum hemorrhage, it is used to control bleeding after childbirth. In treatment of miscarriage, it is used to expel the fetus and related tissues in cases of incomplete miscarriage. Next, dosage of misoprostol tablets. The dosage of misoprostol varies depending on the indication. For prevention of NSAID-induced gastric ulcers, the adult dose is 200 micrograms 4 times daily with meals. If not tolerated, a dose of 100 micrograms can be used. For medical abortion in combination with mifepristone, the dose typically 800 micrograms buccally, sublingually, or vaginally 24 to 48 hours after taking mifepristone. In combination with methotrexate, the dose is 800 micrograms vaginally 3 to 7 days after methotrexate administration. For induction of labor, the dose is 25 micrograms intravaginally every 3 to 6 hours. The dosing may vary based on clinical protocols and patient response. For management of postpartum hemorrhage, the dose is 600 micrograms orally or 800 micrograms sublingually immediately after delivery of the baby. For treatment of miscarriage, the dose is 800 micrograms vaginally or sublingually every 3 hours, up to 3 doses. These are general information and does not substitute for professional medical advice. Always follow your healthcare provider's advice. Next, mechanism of action of misoprostol tablets. Misoprostol works by mimicking the action of endogenous prostaglandins. Misoprostol inhibits gastric acid secretion and increases the production of mucus and bicarbonate in the stomach, providing a protective effect on the gastric mucosa. Misoprostol binds to prostaglandin receptors in the uterus, causing the muscles of the uterus to contract. This leads to the expulsion of the uterine contents in cases of medical abortion, induction of labor, or treatment of miscarriage. Misoprostol softens and dilates the cervix, which is beneficial in labor induction and certain gynecological procedures. Next, side effects of misoprostol tablets. Common side effects of misoprostol include gastrointestinal symptoms, gynecological symptoms, central nervous system effects, and others effects like chills, fever, and shivering, especially when used for abortion or labor induction. Rare but serious side effects can include severe allergic reactions, uterine rupture, and severe bleeding. Next, important advice for using misoprostol tablets. Misoprostol should be used under medical supervision, especially for indications like medical abortion, induction of labor, or management of miscarriage. Follow the prescribed dosage regimen strictly. Overuse or misuse can lead to serious complications. Misoprostol is contraindicated in women who are pregnant, except for inducing labor or abortion, or who are planning to become pregnant due to its abortifacient properties. To mitigate gastrointestinal side effects, take misoprostol with food and plenty of water. Be aware of common side effects and seek medical attention if severe symptoms occur. Misoprostol should not be used without a prescription and guidance from a healthcare provider. In summary, misoprostol is a versatile medication with multiple uses in gastroenterology and obstetrics gynecology. proper usage, adherence to prescribed dosages, and awareness of potential side effects are crucial for safe and effective treatment. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using misoprostol tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.